We have continuing coverage tonight. Wichita police shot and killed a 19-year-old man in the parking lot of the Patrol North Police substation.
It happened around 6:30 this morning. Police identified that 19-year-old as Nehemiah Fleming as the man who died. Police say it happened again at that substation on East 21st by Hillside. They say Fleming asked an officer about department policy on shooting armed people. Investigators say Fleming then pulled out a gun. The officer dove for cover. Two other officers, one on duty, one off duty, saw what was happening and fired at Fleming. He died at the hospital. Police say another man ran from the scene. They found him. No officers were hurt. Police believe the 19-year-old, though, wanted to get shot.
Based on preliminary interviews with family of the suspect, this appears to be a case of suicide by police.
The Sedgwick County Sheriff's Office says no further information will get released until Monday at the earliest. The department, though, says this has left the officers who were on scene shaken.
Kate Devine is here now to explain how officers are trained to respond to these incidents and how they're left to live with the aftermath. Kate?
Deb, Chris, we spoke with Wichita police and training experts who say officers are prepared for these situations on paper, but nothing prepares them for the emotional toll of taking a life, even if it's to save their own.
When they're, determined that that's what they want to do, that's what they want to happen, it can override everything that law enforcement tries to do to de-escalate, and again, potentially forcing a law enforcement officer's hand to use deadly force.
The term is suicide by cop. Experts say it's difficult to predict and devastating for officers who pull the trigger.
They deal with a lot of trauma. Inherently, the job is not easy. It can be very challenging, although very rewarding in the end. But this is a lifelong process for them.
Officers face unpredictable situations and often arrive without full knowledge of what's waiting. They rely on training, experience, and support from specialized crisis teams. Thursday morning, Wichita police say two men confronted an officer in the parking lot of the Patrol North Police Station.
One of those males asked the officer about WPD policy about shooting people who were armed. At that time, the male, a 19-year-old, produced a handgun and a brief struggle ensued.
He says the 19-year-old pointed the gun at the officer. Two other officers witnessed and fired at the man, killing him. Heather Bueller with the Law Enforcement Training Center and Andrew Ford with Wichita Police say officers get mental health and de-escalation training starting in the academy and continuing throughout their careers. But when a person is determined to die, Ford says even well-trained officers can't always prevent it.
Oftentimes through the investigation, it can be learned that that person did want to commit suicide by cop. And that takes a toll because an officer recognizes that it didn't have to happen.
Ford also says that's why Wichita PD partners with the ICT team, pairing officers with mental health professionals, and offers resources for officers after a shooting. If you or someone you know is struggling, the Suicide and Crisis Lifeline is available 24/7 at 988. In studio, Kate Devine, Cake News, on your side.